So it's my pleasure to have with us this morning in this series that I'm calling Reflections from Pharmacy Leaders Advancing the Profession, Mr. Gerald Briggs, who was a pharmacy clinical specialist in obstetrics for a number of years and supported the perinatal support services at Memorial Care Center for Women, and then Miller's Children's Hospital, and then Long Beach Memorial Medical Center in Long Beach, California. He was also a clinical professor at UCSF and at USC. Dr. Briggs, or Mr. Briggs, is known for his contributions as a senior author of Drugs in Pregnancy and Lactation. He's author, of course, of numerous publications on drug therapy in pregnancy or breastfeeding women and drug developmental toxicity. He has been recognized with the National Hospital Pharmacy Quality Award, and ACCP some years ago recognized him with the Clinical Practice Award. So it's my pleasure to welcome Jerry Briggs with us. So we'll start off, welcome. We'll start off with the first question. We'd like to learn about your journey as you developed in your career and really recognition as a leader in the area of obstetrics. And when you reflect on that, you may wish to include key people that influence you or key events that really influence you in this journey.
Okay, well, my first degree from a university was in chemistry. And so I worked as a chemist for Best Foods, quality control chemist for Best Foods in San Francisco. And I did that for 6 months, and it was an interesting job, but boring. So then I went to pharmacy school in 1964 and graduated 4 years later in 1968. Now my initial position was as a pharmacist in Alaska, because I like to fish. So my wife and I went up to Alaska and stayed there for about 8-9 months. And I realized this was not my position. This is not filling prescriptions, was not what I wanted to do. So then I came down to Long Beach and got a position at Long Beach Memorial Medical Center as a clinical pharmacist. But I was in pediatrics, and for 3 years I was in pediatrics, and it was great. I loved working with little kids, but I couldn't use my information and skills that I had. So then I switched over to OB, and that was a break point in my life right there when I got into obstetrics, because the physicians loved to have me there to help them, and basically I managed the drug therapy, chronic disease, and acute disease, and they managed the baby. So it was just a great feeling, and that's what I did for 20 years later. Does that cover what do I need? I go on.
No, that's fine. Yeah, if you think of other things you want to include, that's great. So thank you for that. That's great insights. What do you believe is your legacy, or will be your legacy? I think you have a legacy through your book, but reflecting on your contributions to help advance the pharmacy profession, what are you most proud of?
Well, I'm obviously most proud of that book. That book came about because I got questions from physicians about drugs and pregnancy, and there was no source for it. So I said, heck with it, I'll write the source. But over the years, I just made so many contributions, I thought, that to obstetrics and working with pregnant patients. It just was lovely. On an average, I would see 25 patients a day.
Wow.
That would go from 7:30 in the morning to 4:30 nonstop. I always had a nurse alongside me to help, if the woman had questions. And I went right through lunch, and I had to get another nurse while the other nurse was eating lunch. And I gave up on lunches, and it was just great. I loved it. Eventually, the state of California started paying the hospital for my actions. So that was a breakthrough. Before that, they didn't pay for clinical services. And now all of a sudden they started doing that. So that was a breakthrough. And of course, the hospital was very happy with that.
Excellent. Excellent. Very good. So the next question, you're really addressing students here. Students are one of the audience. But what advice do you have for students in their professional journey? How do they develop as leaders to help advance the profession?
You raise a very, very important point. Over the years, one of my side issues has been getting other pharmacists into obstetrics. And really, they're having worked with physicians and been on a lot of their national and statewide committees. They would love to have clinical pharmacists take over the drug fair. But there just aren't that many. I think you can count maybe 10 or 11 or 12 in the whole United States that have a pharmacist doing something in obstetrics. And so it's very important. I've tried to work on that. I worked at Washington State, where I got my degree in pharmacy. I helped pay for a pharmacist to do a residency in obstetrics. But I don't know if it's gone elsewhere. I've given talks at the universities, and I'm always pushing this. But for some reason, whatever the reasons are, the students don't seem to have an interest in this area. I do know physicians will love to have them. They'll support them. They will be in. If a pharmacist student wants to get in a residency in obstetrics, there are plenty of opportunities.
Wow. Wow.
Unmet opportunities, I have to say.
That's great. Anything else you'd like to give them advice? Usually people are loaded with advice, but I mean, those are really good words of advice. I mean, obviously this field, there's so much potential.
Yes, there's lots of potential in obstetrics. And I say that the physicians would welcome a pharmacy resident. I saw that happen up in Spokane with the Washington State students. And they're very happy to have that pharmacist helping them and learning. And doing a residency in obstetrics would be a great opportunity. And then there would be jobs waiting for them. It's just a question of where they want to go.
Yeah, exactly. Exactly.
In fact, I mentioned that Dr. Freeman, one of the co-authors of my book, is a well-known nationally, internationally known optician. And he would tell me, Jerry, tell me where they want to go. I'll have a job for them in 2 hours.
Wow.
And I said, 2 hours? He said, I know that's a long time, but I'll get it for him. That's how many opportunities are out there.
Wow. Wow. That's encouraging. That's very good. So one of the last question I have, and any other words you want to give us will be great. You know, these videos are being embedded in a history in pharmacy leadership course. But as we study the history of the transformation of our profession, I believe the decade of the 2020s will be an important one, because in that decade, of course, will be the COVID-19 pandemic. Like other events in our history, events that occur external to our profession shapes the profession and many times creates opportunities for the profession. Do you have any thoughts or insights on how you believe that will help to shape our profession?
Well, obviously, clinical pharmacy is shaping our profession. I can see down the road in a not too distant future, at least here in California, that pharmacy technicians will be filling the prescriptions and dispensing. You won't need 4 years of university, or maybe 8 years, before pharmacy school, to fill a prescription. And I think you'll see maybe a pharmacist there who can work with a patient and consult with the patient with a prescription, but the actual work will be done by the technician.
Mhm.
The opportunities out there clinically in obstetrics, as I mentioned, are huge. And they just have to have pharmacists who have an interest in doing that. And I've helped some, and they've got great jobs, but there's such a huge need for those right now that not being met.
Mhm.
So if I was going through pharmacy school right now, I know it sounds silly, but if I was going through the pharmacy school right now and someone told me that, I'd go after it.
Right.
I go after it because that's, the three aspects of clinical pharmacy. You order the drugs, you manage it, and you publish, and you research. And they're all sitting there waiting to be all three of those things, waiting and for pharmacists who come to them.
Mhm. Mhm. Excellent, excellent. Well, I appreciate that. If you have any other thing that I didn't ask that you'd like to share with us, and as regarding anything, we'll be willing. We're listening.
Well, if they have any interest in research, uh, that's numerous opportunities for research. I know I've done nearly 100 research projects while I was at Long Beach Memorial, and so that the ability and desire for it is there. Someone has to come up to it.
Mhm.
I wish them all luck. They can contact me and I can give them advice. They may not want it, but
That's very good. So one comment I'll make, it looks like a lot of what you got into was self-developed efforts, not necessarily in your training, that you were trained to be an obstetrics pharmacist and obviously even to do research.
well, you bring up a very important issue. In pharmacy, when I went to pharmacy school, the word pregnancy never came up,
Mhm.
or obstetrics, it was never mentioned. When I'm giving lectures, for example, at USC, I mention obstetrics, and I get people say, well, it's never been mentioned here in 4 years. So I think it's important in the pharmacy schools if they start looking at this. At Washington State now, there's a one-semester course
Oh, wow.
on obstetric pharmacotherapy.
Mhm.
And so it's not a required course. I would like to have it required, but it's a one-semester course that most students take.
Mhm.
In fact, there's the dean up there told me that all students would let you take it. It's a course they teach there at Spokane.
Mhm. Mhm. Excellent, excellent. Well, again, it's been my pleasure. I'm so glad I got a chance to talk with you and interview you. And it's always a pleasure. And thank you very much for your time.
You're welcome, most welcome. Have a great day.